Recently on social media, I posted a video stating that type 2 diabetics should not be upset with obese people for using the popular weight loss medications commonly called Ozempic, Mounjaro, etc. And a few people were a little offended, saying, how is it that I could say that it's okay for people who just want to look better to be using life-saving medications that type 2 diabetics need? So I decided, let me do a longer video explaining why I said that, and there are three things I'm going to talk about in this video. One is the fact that there are other medicines that are shared between diseases. Two, why is it that I'm saying that both type 2 diabetes and obesity have the same underlying cause? And three, just how these popular weight loss medications help both type 2 diabetes and obesity. So for those of you who are seeing me for the first time, I'm Dr. Amina Goodwin, and I'm a physician, and I'm also a health coach. I help you lose weight by eating more. So check the links below and you can see some of the resources that I have to offer. Let's dive right into this. So there's a big uproar in the news now about shortages of these life-saving diabetes medications, and people are blaming celebrities and other people for using these medicines when they don't need them. But I am suggesting to you that obesity is a disease, just like type 2 diabetes is a disease. Now, going back to what I said, I'm going to talk about first, the fact that there are other medicines that are shared between diseases. So, for example, there's a blood pressure medicine, the different classes, but a common name is lisinopril, and that medication is sometimes given, in fact, it's usually given to most diabetics to help protect their kidneys from damage. And so hypertensive patients are not going to say to a diabetic, you can't use my medicine, I need it for my high blood pressure. No, that's not going to happen. There's another diabetes medicine, relatively new, that was approved for use in persons with heart disease, because it's been shown to help those heart disease people, even if they don't have diabetes. So, generally speaking, regular diabetics are not going to go to somebody with heart disease and say, no, you can't use my medicine, I need it, you don't need it, your disease is not as important, right? That just doesn't happen. And generally in medicine, in the field of medicine, there are a lot of different medications that are shared between diseases. There are a lot of diseases that share like underlying root causes. Cancer, for example, there are some cancer drugs that are used for many different cancers. And so the idea of obese people taking a drug that was initially authorized for use in diabetics it's not anything new. It's nothing new, and the fact is too that everybody is trying to get better. All diseases deserve to be treated, and if there's a drug that is found to be very, very helpful in another disease, well, by all means, that person should benefit from the drug as well. Okay, so this is nothing new, sharing drugs between different diseases. Now, to the point about obesity and type 2 diabetes having the same root cause. What is that same root cause? That root cause is insulin resistance. What is insulin resistance? How does it develop? So insulin resistance is a situation where the insulin in the body does not work efficiently. How does that develop? That develops after maybe years or less, but essentially after consuming sugar and refined starches, essentially consuming anything that increases blood glucose and doing it in excess so that the blood sugar levels stay high for more often than not. So what happens, just to explain the whole insulin glucose situation, we eat starch, sugar, it gets into the bloodstream, blood glucose levels go up, but ideally the body likes nice stable glucose levels because high glucose levels ultimately are toxic to the cells. And so the body's response is always to produce insulin quickly to get that blood glucose level back down. Like I said, you get glucose going up from sugar, high fructose corn syrup, starch, because starch is a string of glucose molecules, so it breaks down after it's ingested and goes right to the form of glucose and increases blood sugar levels. Blood sugar levels go up, we're eating more, sugar, starch, but we're moving less, and so therefore we're not burning off that glucose as we would have in the past. And so because that glucose is not being burned, it has to be stored. How is glucose stored? Glucose is stored as fat. It is stored as fat. And so because all the cells of the body can metabolize or can utilize glucose, it means that it can be stored all over. You can have it stored as fat amongst the muscle cells. It stores in the fat tissues, and it can be stored in the liver as well. And so you have any excess glucose that is not burned off for immediate use for energy, it's stored around the body. And so what happens is that as you need more and more fat storage, the cells get pretty packed with fat, and the receptors that accept the insulin, which is the hormone that pushes the glucose into the cells, eventually, because they get bombarded constantly throughout the day because of the onslaught of glucose throughout the day, these receptors start becoming numb to the effect of insulin. So basically it's like a key, and that just locks and shuts out insulin. So if insulin is not able to do its work to let the glucose go into the cell to be stored as fat, it means that the glucose stays in the bloodstream and it stays high. Because the blood glucose is staying high, the pancreas is constantly getting the signal, produce more insulin, because it's thinking, okay, well, there must not be enough insulin to finally get the glucose levels down. And so the pancreas continues to produce more insulin. And so as you have the blood glucose, you're eating it, it's staying high, insulin is being produced, but now the cells, because they've been bombarded so much by this insulin, as a protective mechanism, they shut off, and so they ignore the effect of insulin. And so you just have this vicious cycle where insulin levels stay high in order to really just manage to get the glucose to come down to some degree of normal. The problem here with this high insulin is that insulin is a pro-growth hormone. It stimulates growth, it stimulates fat storage. And so as long as insulin stays high, you are never going to be able to burn off any of that fat that you have in storage. And instead, you just continue to pack on and pile on fat, and you continue to gain weight, you continue to store fat in your liver. And so, and like I said, continue to gain weight, and then ultimately some people will not be able to keep up this anymore, and so the blood sugar levels start going up, and then it's pre-diabetes, and then ultimately they are type 2 diabetic because the blood sugars stay pretty high all the time. So that is how that insulin resistance problem is causing all these issues: obesity, pre-diabetes, diabetes, type 2 diabetes, fatty liver. All those are on the same spectrum of insulin resistance, which in insulin resistance, the blood insulin levels are always high. And so you're always in this fat storage mode, and you can never be in fat burning mode. So now this medication came about, semaglutide. They discovered it. It's been out since after I came out of medical school, after I came out of residency. And this came out as a drug to help diabetes. And then they noticed diabetics were losing weight. So they realized, oh, we can probably use this for obesity, because obesity is such a big problem. And of course, recognizing that obesity is not just about looks, but it's about the fact that there's disease because of the persisting insulin resistance. How does Ozempic, the real name is semaglutide, but let's just say Ozempic, since that's the one that's the popular brand name. It comes as Mounjaro, Wegovy. So this medicine has several mechanisms of action. One is that it helps insulin to work a little more efficiently. It also stimulates the production of insulin in response to glucose in the bloodstream, which kind of contributes to the whole problem of insulin resistance, because insulin levels are already high anyway. But anyway, there are other mechanisms as well. It blocks another hormone that increases glucose levels. And then finally, and this is the big one, it actually slows down the emptying of the stomach, so that food takes longer to exit the stomach. And so because you get full really quickly, ultimately you eat less. So all these mechanisms together, and especially the whole thing about eating less, results in somebody losing weight. And yes, blood glucose levels get better in a diabetic, but it's that whole action of weight loss that actually helps to reverse the insulin resistance problem. So once you start losing weight, the fat cells are getting a little ease. They're not as packed with fat. The liver doesn't get as packed with fat because you're able to lose weight. Some of the fat stores are able to be burned off. And so this continued weight loss helps the insulin to become more sensitive. So the cells wake up, they're not being bombarded quite as much. And so, by both glucose and then even the insulin, so they wake up and they start accepting insulin. So insulin can attach as a key and do what it has to do. And so because insulin is now able to work, it means that blood sugars are able to come down even more. And so the type 2 diabetes gets better, the weight decreases, and with continued weight loss, the insulin resistance continues to be reversed. And so that is how these drugs help both obesity and type 2 diabetes. Both conditions get better, and both sets of people are able to live and lead a healthier, more vibrant life. So don't blame if you're diabetic, or nobody should blame anybody, because you know what, all diseases are diseases, and who am I to say my disease is worse than your disease, right? Everybody who is suffering from a disease has their own issues that they're dealing with, but these drugs, they help more than one thing, and that's a good thing. Thing about type 2 diabetes, fortunately they have lots of medicines to help them. It's not like type 1 where their only saving grace is insulin. Okay, so in that case, really, we wouldn't want a situation where people are abusing insulin. But for type 2 diabetes, there are lots and lots of options. And additionally, type 2 diabetes really and truly is a lifestyle disease. And so it means that there's a lot of adjustments that can be made in the lifestyle. Big one being eating more unprocessed, wholesome foods, more fruits, vegetables, peas, beans, nuts, fish, eggs, meat, just food that you can look at and tell what it is, and have less of those very processed packaged foods that oftentimes are packed with sugar and just very, very, very refined starches that are going to go to sugar in your bloodstream. So that is all I have to say about that. Don't blame anybody. Whatever a disease can help, yes, and obesity is not just an appearance problem. It's not vanity. It's actually a disease, and it deserves to be treated. The drugs, I think, should be thought of as a temporary fix, so that the lifestyle changes can set in, and once you're over the hump and your insulin resistance starts going down, then you learn, okay, how to eat so that you can maintain the weight loss and continue to remain insulin sensitive going forward. I hope you all found these explanations helpful. If you found this video helpful, share it with somebody else, and thank you for watching.